We've all heard the saying, money can't buy happiness, but new research is suggesting there may be more to consider. A new study published in the Journal of Epidemiology and Community Health suggests raising the minimum wage by just $1 could lower the national suicide rate and save thousands of lives. And when you think about the federal minimum wage is $7.25 an hour. There are some states, of course, where that is higher. And when looking at this minimum wage, it's quite remarkable. Raising it by $1 lowered suicide rates by 3.5 to 6%. That equates to 27,000 lives, if not more. And it makes sense.
Yeah.
I mean, it makes sense that if you're struggling to get by, and you're in despair, and you have no economic stability, and also dealing with any other problems in the household, that increases suicide rates.
Well,
so a little bit more money can help.
Yeah, it does make sense. And you know, you led off by saying money can't buy happiness, but you're talking about money just for the basic needs to live in a decent place and be able to get regular meals and
to not be in despair.
Yes.
They're sad and they're depressed, and it's hard.
Look, minimum wages should be different state to state because there are some states where the cost of living is much lower, but $7.25 just, it seems a little bit anachronistic. And if you could raise it by $1 and see this drastic decrease in suicide rates, economic stability for families is also so very important when you start talking about kids.
More likely to have a less stable home environment, more likely to develop a substance abuse, especially if you're depressed. So it's sort of a vicious cycle that's created. You know, interesting enough, part of the study that college graduates did not play into the study. It didn't affect the rates. So I guess we can extrapolate that the more education you get, the better. Better chance of earning more and having a better livelihood. So whatever it takes for you to get more education beyond high school is valuable.
Well, the one thing that I will say, the amount of income inequality has gotten a little bit out of control in terms of, well, just in terms of if you look at the top 20 people in this country and how much they're worth, it is so astounding. And it's hard not to look at some of these people, and we've even talked about it in hospitals in America where you find out that maybe a CEO of a hospital-based company makes $10, $15 million, and then, you know, maybe the individual that's making sure that hospital is clean and safe for surgeries is making $7.25 an hour. You know, that it's hard, regardless of your politics, to not think that, you know, maybe that person in the ivory tower and making $15+ million, that maybe, you know, maybe we could hike by $1 the amount that someone is making.
I mean, yes. I mean, looking at that hospital model, that guy,
it's a pretty classic model.
That has to keep it running. Whatever it is, whether it's keeping the linens clean, keeping the place clean, whatever is as important part as that CEO.
Everybody's a part of the team. But, you know, hopefully things will change. You know, we always hope that. But in the interim, we know that chronic stress is hard, but we never want anybody to kill themselves because they are stressed. Make sure you're talking to a healthcare provider. Make sure that you're reaching out to someone to try to get help to get you in a better situation. Or if it is something financial, maybe they can let you know about different resources that can help you out, whether it's buying food, whether it's getting your medicine, whether it's getting childcare for your children, whatever it is. But there is definitely always a better answer than suicide, so please reach out.
And if you do make that minimum wage, you actually, if people are out there and they don't understand the tax world, you can actually get an earned income tax credit. So there's actually a way to increase how much your take home is. And there are a lot of people out there, they've done studies where people don't actually get the credits that they're allotted because maybe they don't understand all of that. So look, no easy answer here, but you can't deny the facts. If raising it $1 could prevent 27,000 deaths, you have to ask yourself, is that money well spent? I would argue it is.